Hey everybody, I want to talk a little bit more about recovery in substance use disorder and some of the methodologies used by patients that are in recovery. And I think the most important one that we see most often is, aside from behavioral and cognitive therapies, is medication assisted treatment, or MAT therapy. It is used in conjunction with the therapies, the counseling, AA, NA meetings to keep somebody from relapsing on opioids or alcohol. And MAT is most commonly used in opioid use disorder, not so much alcohol, but it varies from person to person what their preference is, as well as their provider. But the whole purpose is these medications are given according to the need of the medication, sometimes daily, and sometimes it's prescription from your doctor. Sometimes the person will go to a clinic and be given their dose for the day. But the point of these medications is to reduce the withdrawal symptoms, cravings, and relapse risks. Most commonly used in opioid use disorder you see is methadone and buprenorphine, also known as Suboxone. There's another version called Subutex as well. And then there's also naltrexone. Methadone, it's a full opioid agonist. It's administered orally through outpatient treatment programs, and patients must meet specific criteria before starting methadone treatment. There are side effects with methadone, including respiratory depression, sedation, and constipation. And this also carries a risk of overdose. So that's something we'll talk about in a minute. Buprenorphine is a partial opioid agonist. It's available in 3 different forms: sublingual films, there's tablets, or extended release injections. And patients must be exhibiting mild to moderate withdrawal symptoms before an initiation of this medication. Side effects of buprenorphine include headache, nausea, sometimes precipitated withdrawal if the opioids are still within the person's bloodstream, in their system, basically. Naltrexone is an opioid antagonist. It's available in oral and extended release injectable forms. Patients must be opioid free for at least 7 to 10 days prior to administration to avoid withdrawal. Side effects of naltrexone are hepatotoxicity and injection site reactions. For alcohol use disorder, the medications they use are dysfularium, naltrexone, and acamprosate. Dysfularium is an oral medication. It inhibits the acetaldehyde metabolism, which is what causes unpleasant effects when alcohol is consumed. The patient must abstain from alcohol for at least 12 hours before initiating this medication. And it can include nausea, vomiting, and some cardiovascular reactions as side effects. And we talked about naltrexone already in the MAT opioid use, but they're very similar, and it just blocks the alcohol cravings. And then the acamprosate, this medication, stabilizes the neurotransmitter balance and reduces cravings. It's taken orally, but it may cause diarrhea and other GI distress. Side effects, like I said, we were going to talk about for methadone and buprenorphine. They carry risks of overdose, particularly if misused or combined with other depressants like benzodiazepines. The other medications do not carry any more great side effects or risk of overdose. Daily life with a MAT, it helps individuals maintain their recovery and their sobriety, reduces their cravings, helps stabilize their mood. Adherence to these treatment programs could be cumbersome for some people, especially if they're working or they have other needs they have to take care of at home, because the daily clinic visits are required for some of these medications. It may inhibit someone wanting to start the medication or stay on the treatment plan. These medications, especially methadone, are strictly regulated. They require enrollment into a certified outpatient psychiatric program. Buprenorphine can be prescribed by a certified healthcare provider, so that is one benefit there. But patients using MAT, they may face some stigma and some legal challenges, such as restrictions to employment or housing due to this particular medication use. But like I said, it is a treatment plan that individual is going to have to work with their provider, see what fits into their life, help them, get their job with the understanding, be upfront with their employers, because these medications will show up in drug screens. So being upfront and honest with your employer, if you are on one of these MAT medications, is going to be key. Letting them know that, hey, I have to report to this clinic every day for my medication. I can't be at work until this time. It's a conversation that is going to be individualized per each person and their place of employment. But taking a MAT will help somebody maintain sobriety, stay in recovery, and has long-term benefits to their recovery. But there are challenges, such as the side effects, the scheduling of the clinical sites. There may be some social stigmas, and there also may be some legal regulations in terms of, employment and housing, like I said. Either way, MAT medications are definitely a tool that one can use in recovery from opioid and alcohol abuse. And it's an important conversation to have with your treatment provider, especially if you're starting out in recovery and detox, as to which way you want to go for long-term recovery. But these medications are not used solely alone. They have to be combined with therapy, with continuing going to meetings, and meeting with your provider. And I will see you next time. Don't forget to like and share and subscribe and comment for more. If you have any questions, let me know.